Facial expression is a secondary byproduct of the ability to finely control the facial orifices. Facial expressions are essentially orifice displays. Think about what you are actually doing when you smile, frown, wink, glare, or otherwise express yourself. Facial expression is a generalized mammalian feature that is most highly developed in humans. In this program, we will organize the facial muscles into functional groups according to their actions on the facial orifices rather than on their strict locations within the face. Chapter 4 reviews the muscles in the face. There are 2 study objectives here. First, identify the major muscles of facial expression, their innervation, and their actions. Second, predict the functional deficits expected following paralysis of the facial muscles. When we discuss the facial muscles, we are referring to the muscles of facial expression. Sometimes these are termed the mimetic muscles. Most of these are located within the face. However, some extend into the scalp, and one is located in the neck. The facial muscles do not include the muscles of mastication, even though some, such as the masseter, are located within the face. All the facial muscles are innervated by the facial nerve, cranial nerve 7. This pattern of innervation reminds us that all these muscles share a common developmental origin in the second branchial arch. We'll look at the details of the nerve tree in the next chapter. The facial muscles are essentially integumentary muscles. That is, they are contained mainly within the skin. Their origins may be bony or cutaneous. However, their insertions are always cutaneous, meaning that they attach into the dermis, the superficial fascia, or other facial muscles. It's important that you do not confuse these muscles with the erector pili muscles. Remember, the erector pili are smooth muscles that attach onto hair follicles. The facial muscles are true skeletal muscles. The facial muscles are subject to tremendous individual variability in size, shape, thickness, strength, and general degree of development. Therefore, the actions of these muscles are individually variable and diverse, especially in their more subtle uses. The specific muscles that we will examine here include the major facial muscles. Some authors describe some additional, smaller, more variable muscles as well. The primary biological role of the facial muscles is to control and operate the facial orifices, that is, the eyes, nose, mouth, and ears. Because of this, they must be considered as accessory muscles of vision, olfaction, respiration, feeding, and hearing. In the frontal view shown here, the dissection on the subject's right side, that's your left, is at a slightly deeper plane than that on the subject's left. Now, let's first examine the muscles that operate the eye. These are orbicularis oculi, corrugator supercilii, procerus, and frontalis. The orbicularis oculi is a broad muscle that encircles the orbit and acts as the sphincter muscle of the eyelids. It has 2 main parts, a palpebral part within the eyelids and an orbital part outside the eyelids. The corrugator is a small muscle that acts to pull the eyebrow down and medially, as in frowning. Its contraction produces vertical wrinkles between the eyes. The procerus is typically denoted as a muscle of the nose. However, it actually acts to pull down the medial ends of the eyebrows, thus functioning at the eye. Its contraction produces transverse wrinkles across the bridge of the nose. The frontalis usually is designated as a muscle of the scalp because it is a component of the epicranius. However, in humans it has a major effect on elevating the brow, as when glancing upward, thus functioning at the eye. Its contraction produces horizontal folds across the skin of the forehead. The frontalis does work in concert with the occipitalis, a muscle in the back of the scalp. The frontalis and occipitalis muscles are connected to each other by a broad aponeurosis across the scalp. The aponeurosis is termed the epicranial aponeurosis, or the Galea aponeurotica. The entire unit of frontalis, occipitalis, and epicranial aponeurosis often is given the collective name of epicranius or occipitofrontalis to reinforce the functional connection of its components. Remember, the epicranius forms the A layer of the scalp. Now, let's look at the muscles that operate the nose. These are nasalis, depressor septi, and levator labii superioris aliquae nasi. The nasalis is a small muscle composed of two parts, a transverse part and an alar part. Sometimes these are described as two separate muscles. The transverse part might be termed the compressor nares. This attaches with its opposite mate across the bridge of the nose. The alar part may be named the dilator nares. This attaches to the alar cartilage of the nose. As the names imply, the transverse part compresses the nasal aperture, whereas the alar part expands the nasal aperture. The depressor septi is a very small muscle that attaches to the anterior inferior part of the nasal septum. It acts with the alar part of the nasalis to expand the nasal aperture. The third muscle of the nose is the levator labii superioris aliquae nasi. This impressive name translates to levator of the upper lip and ala of the nose. Thus, the muscle operates both these structures. The medial part attaches to the alar cartilage and skin and dilates the nostril. The lateral part attaches into the lateral part of the upper lip, blending with other muscles. It acts to raise and evert the upper lip. Next, let's examine the muscles that operate the mouth. There are 12 muscles in this group, reflecting the complex nature of the region. These are orbicularis oris, levator labii superioris aliquae nasi, levator labii superioris, zygomaticus major, zygomaticus minor, levator anguli oris, risorius, buccinator, depressor labii inferioris, depressor anguli oris, mentalis, and platysma. The orbicularis oris is a broad, very complex muscle that encircles the mouth in a sphincter-like fashion. It interacts with the other orofacial muscles to modify the form and tension of the lips and their margins. Refer to the preceding section on the muscles of the nose for a description of the levator labii superioris aliquae nasi. The levator labii superioris is a relatively large muscle that runs from the inferior orbital margin into the upper lip. Acting in concert with its neighbors, it raises and everts the upper lip and modifies the form of the nasolabial sulcus. Notice that it covers the infraorbital foramen. Thus, in dissection, you must transect the levator labii superioris and reflect it out of the way in order to see the emerging infraorbital nerve and vessels. The zygomaticus major is an elongated muscle that attaches into the angle of the mouth, drawing it laterally and superiorly. The zygomaticus minor is an inconstant muscle that may be incorporated wholly or partly into the zygomatic major or the levator labii superioris. When present, it attaches into the upper lip and assists in elevating that structure. The levator anguli oris inserts into the angle of the mouth, drawing it medially and superiorly. The risorius is a highly variable muscle. It runs from the lateral part of the face into the angle of the mouth, drawing that area laterally and variably upward. Although named for and usually associated with the expression of laughter, it probably has no more influence on that action than any other muscle acting at the angle of the mouth. The buccinator is a significant structure in the face. This wide, thin muscle lies relatively deep in the cheek, coursing from the pterygopalatine raphe to the area of the angle of the mouth. The paired buccinators compress the cheeks. They are important in all phases of feeding. During mastication, they assist in positioning food between the molar teeth. In suckling, they create pressure within the oral cavity. This pressure also serves in blowing air, as when playing a wind instrument. Remember, the word buccinator translates as trumpeter. However, the buccinator can be seen much more easily and to a much greater extent when dissecting the cheek from the oral side. Be sure to identify the buccinator when you dissect the wall of the oral cavity. Notice that the parotid duct pierces the buccinator in order to reach the oral cavity. Also, the facial artery and vein, buccal branches of the facial nerve, and the buccal nerve, which is a branch of the trigeminal, cross its superficial surface. The nerve branches are not shown in this illustration. They'll be described in the next chapter dealing with nerves. Because of its position and relations, the buccinator may be a bit difficult to locate and appreciate when dissecting the face. The depressor labii inferioris runs from the anterior inferior aspect of the mandible into the lower lip, where it blends with other muscles. It draws the lower lip inferiorly. The depressor angulioris is a fan-shaped muscle that inserts into the angle of the mouth. It pulls the corner of the mouth inferiorly and laterally. The mentalis is a small conical muscle that inserts into the skin of the chin and the base of the lower lip. It acts to raise, protrude, and evert the lower lip, as in pouting. The final muscle of the mouth is the platysma. This is a broad, thin sheet of muscle that lies mainly in the neck. However, usually it has significant attachments to the body of the mandible, the lateral aspect of the lower lip, the angle of the mouth, and the skin in the lower lateral face. It can pull the lower lip and angle of the mouth inferiorly, and may assist in depressing the mandible during jaw opening. Our final group of facial muscles consists of the muscles that operate the external ear. These are essentially vestigial muscles in humans. So don't worry, you won't be dissecting these muscles unless you do advanced specialty studies on the face and ear. For a general course in gross anatomy, just be aware that these muscles exist. The auricular muscles are more complex and functionally significant in mammals that possess large, mobile auricles that serve to collect and direct sound waves. There are two subgroups of auricular muscles. The first subgroup consists of three extrinsic auricular muscles. These connect the auricle to the skull and scalp and potentially move the entire auricle. They are auricularis anterior, auricularis superior, and auricularis posterior. The second subgroup consists of several intrinsic auricular muscles. These are very small muscles that connect various parts of the auricle and potentially modify its shape. This group includes the helicus major and minor, tragicus, antitragicus, transversus auriculae, and obliquus auriculae. The following video will review the major facial muscles on a plastic model commonly used in general anatomy courses. Let's use this commercial plastic model to review some of the major facial muscles. I'll start up at the top of the face and work my way down toward the chin, identifying the muscles that are identifiable on this model as we go along. Let's focus in on the forehead to start with. We can notice this large, almost quadrangular sheet of muscle coming down out of the forehead into the upper orbital and nasal regions. Off of the forehead, then, this muscle is the frontalis. Below that, we can see a large, circular, sphincter-like sheet of muscle surrounding the orbit. This is the orbicularis oculi muscle, and we can see here that this muscle can be divided into two portions, a palpebral portion contained within the eyelids, and a larger, more variable extending orbital portion outside of the eyelids themselves. If we move over to the nose, we can see a transverse aligned sheet of muscle fine muscle sheet coming off the side of the nose. This is the nasalis. On this particular model, we can't really differentiate between its two subparts, and so again, in this case, we'll just go with nasalis for this entire sheet of muscle. Alongside of the nose, we can make out another bundle, one edge of the muscle running along here, the other edge of the muscle running out along here. So we have this sheet from here across to here, coming off the side of the nose, running down the side of the nose and into the midface. We can see that part of this muscle attaches here onto the ala of the nose, and part of it runs down into the upper lip. So this sheet of muscle right here has the wonderful name of the levator labii superioris aliquae nasi. That is the muscle that elevates the ala of the nose and the upper lip. A bit further off to the side, at this point we can see the apex of the cheekbone right about here. We can see a nice longitudinal bundle of muscle coming off the apex of the cheek and running down into the angle of the mouth. Because this comes off of the zygomatic bone for the largest part of its extent, this is the zygomatic major muscle. Closer toward the midline, on the way this model is made, we can see another sheet of muscle also coming off the area near the apex of the cheek, but a smaller muscle running up higher, and actually this should be more accurately shown coming into the upper lip. The model maker took a little bit of artistic license here, but such as it is, this sheet of muscle right here will represent the zygomatic minor muscle. Just below that, we can see a bit of a muscle shown on the model right here. This actually comes off the face below the zygomatic, or really deep to the zygomatic minor muscle. It would really be coming off of the maxillary bone right underneath the orbit and running down into the upper lip. This is the levator labii superioris muscle. As we move down around the mouth, the first, most obvious muscle is another large, circular, sphincter-like sheet of muscle surrounding the mouth. This is the orbicularis oris muscle. Off of the side of the face, running along the side of the cheek and attaching into the angle of the mouth, is a small muscle shown right here. This is the risorius muscle. In the lower part of the face, we can see a large fan-shaped sheet of muscle coming up off of the lower edge of the mandible and sweeping up into the angle of the mouth. This piece right here is the depressor anguli oris muscle. Closer toward the midline, another muscle coming off the lower edge of the mandible, angling up into the lower lip, really into the body of the lower lip rather than over toward the angle of the mouth. This muscle sheet right here is the depressor labii inferioris. One more muscle on the chin region, here coming off close to the midline and running up into the mid portion of the lower lip, the muscle right here, which is the mentalis. If we move back over to the side again and look into the cheek area, remember here is the risorius, here is the zygomatic major. If we look a little bit deeper into the cheek and look in between other muscles, we can make out a nice horizontally aligned quadrangular shaped muscle. Most of it shows on the model right here, a little bit of it peeking up right down through here, but this represents the buccinator muscle, this large important muscle deep in the cheek. As we move back across the side of the face, we want to recognize importantly, here's the zygomatic arch, a very large, heavy-duty muscle coming off the zygomatic arch and running down to the angle of the mandible. This is the masseter muscle. But the important thing for us to remember here is that not all of the muscles that are located in the face are true facial muscles, or muscles of facial expression. Remember that the masseter is actually a masticatory muscle with a different innervation history than the other facial muscles, So again, although it's located within the face, it's not considered to be one of our facial muscles. The final muscles that this model shows in our facial group are a couple of bits of muscle related to the external ear. The external ear here, or the auricle, we find a thin band of muscle above the auricle here, attaching down into the external ear apparatus. This will be the auricularis superior muscle. And on the model, a small bit of muscle right here. This represents the auricularis anterior muscle, just a little bit of the vestigial musculature that works the external ear in humans. The following video clips will review some of the major facial muscles in dissection, beginning in the forehead and proceeding down into the lower face and neck. Here in the upper part of the face, upper eyelid, slit between the upper and lower eyelids here. This is the region of the forehead, and we can see here a thin, wide sheet of muscle coming up into the forehead, overlying the frontal bone. So this is the frontalis muscle. And then forming a circular network of fibers around the eye, the orbicularis oculi muscle. Very thin, delicate fibers encircling the eye in a sphincter-like fashion. Here in this angle, in the anterior mid part of the face, we can recognize again the orbit here. Here's upper eyelid, slit for the eye, and a little bit of the skin on the lower eyelid left in place, and the nose over here. Let's look at the nose. If I pull the nostril down a little bit, we can see coming off the bridge of the nose here a thin sheet of muscle fibers coming off the nose and down across the side here. These are transverse parts of the nasalis muscle. If we look right on the side of the nose, we can make out a longitudinal sheet of muscle fibers flaring off across the side of the nose and down into the upper lip. And I can lift up the lower side edge of this muscle sheet a little bit right along here. This muscle bundle has a long and colorful name. This is the levator labii superioris aliquae nasi. So as the name translates, this is the levator of the upper lip for the part that runs into the upper lip, and of the ala of the nose for the fibers that run down here into the alar cartilage on the side of the nose. So this long bundle coming right down across here. If I fold the levator labii superioris aliquae nasi off to the side a little bit and look here at the lower edge of the orbicularis oculi and bring that up a little bit, we can make out a very nice distinctive quadrate-shaped muscle here coming off of the lower orbital margin and running down into the upper lip. And this muscle is the levator labii superioris, the levator of the upper lip. Here in the upper cheek region, we can recognize a couple of more distinctive facial muscles. For orientation, again, this point right about here represents the apex of the zygomatic bone, so we're right in the middle of the cheek. Here's the eye, the slit between the upper and lower eyelids, the nostril over here. Coming off of the apex of the cheekbone, we can see a very distinctive band of muscle fibers right here, coming off the cheek and down toward the angle of the mouth. These fibers make up the zygomatic major muscle. Just above those, we can recognize another smaller sheet of muscle coming off, also off of the cheekbone, a little bit higher and more medial than the zygomatic major, coming down again in toward the upper lip region, and this muscle bundle here represents the zygomatic minor. Here around the mouth, we can identify three muscles that show up relatively well in this dissection. Here's the line of the mouth. We can make out a set of circular fibers running around the mouth in this pattern. These make up the orbicularis oris muscle sheet. We can also differentiate here, coming off the lower edge of the jaw and running up into the angle of the mouth from below. This very thin muscle sheet here will be the depressor anguli oris, that is the depressor of the angle or corner of the mouth. And again, we can also make out the upper edge of the platysma, where it has come up out of the neck and is intermingling with the lower edges of some of these lower facial muscles around the oral cavity. Here in the area in the cheek, we can recognize several fine facial muscles. First, for general orientation, here's the angle of the mouth. Over here, this shiny white area marks the tendon along the anterior edge of the masseter muscle. We see overlying the masseter here and here, fine strands of facial nerve coming out of the parotid gland, which is in this area, again coming across the masseter and on into the face. And a little bit lower in our field, we can see the lower edge of the facial artery, where that is coming up out of the neck and moving on up into its course along the side of the face. Now in this area, depressor anguli oris here, orbicularis oris around the mouth. And now we can recognize a very small little wisp of muscle fibers right here. This represents what there is of a risorius muscle coming across the cheek and toward the angle of the mouth. And just above and deeper to that, we can recognize a series of deeper muscle fibers right in here. And if I move these facial nerve fibers back and forth a little bit, we can recognize this relatively quadrangular shaped muscle mass deeper in the cheek, running across the cheek and toward the angle of the mouth. And this is the buccinator muscle. The platysma is a wide, very thin sheet of muscle that comes up out of the neck and laps up into the lower edge of the face. Here we can see the boundaries of the muscle, again coming up out of the neck and up across the lower edge of the mandible, up into the lower edge of the face. The anterior edge of the muscle here, off the midline, the posterior edge of the muscle back here. Again, a wide, very, very thin sheet of muscle fibers out of the neck and up into the lower edge of the face.